I had cancer in '99. I was having terrible headaches and I was just not feeling well. I went to my doctor and she suggested I see a neurologist. I thought maybe, I had a tumor or something, and that was cancers.
The neurologist decided Grace should have a CAT scan to calm her fears.
His secretary made a phone call to the general, and I'd have to wait 3 months.
Long wait times like Grace's have been an ongoing concern for patients. Until recently, Ontario didn't have enough information about who is waiting for what procedure and how long they've been waiting.
Well, I think what was wrong was we didn't count the wait times at all. There was no current information to give the public, for physicians to give one another. The hospitals themselves had no idea how long people were waiting for services in their own hospitals.
And that's why in November of 2006, the Ministry of Health in Ontario established the Wait Times Information System, or WTIS, and put in place a powerful IT solution as a way to count and measure wait times in a meaningful way.
When the WTIS was first launched, the goal was to include all waits, but clearly that's an astronomical task. So it started with patients waiting for cancer treatment, cardiac surgery, hip and knee replacements, cataract surgery, and patients waiting for MRI and CT scans.
Now, with accurate wait time information, WTIS can help doctors, surgeons, and hospitals do a better job of managing care and putting resources where they're needed most.
Well, as a cancer surgeon, WTIS has provided me the information about how much care in my area is required, and it has in the end led to new resources being given so that we can meet the needs of the patients.
So it's really looking at all the people on the wait list, not just registering them, but actually tracking them and looking at how best to manage care at a patient level, giving tools to surgeons and patients and administrators to do that. That's been the effort.
Before the wait list system, there was no provincial standard to establish who needed care the most.
Okay, and she's priority level 3 for this wait time system.
Now WTIS requires doctors to prioritize every patient scheduled for a procedure.
In the operating room. A priority assessment is very important because different patients, even with the same condition, may need their care with different urgency. The ultimate goal is to deliver each patient the care they need in the time frame they need it.
A big part of the strategy is to share all wait time information with the public online. This gives patients like Grace the capability to find out how long they should wait and where they might access care faster. In March of 2006, Grace went searching for faster care.
I checked out a website, www.waittimes.com, and found that McMaster had just 9 days of wait times. So we went to my doctor, and she made the appointment, and it was within a week that I got in there, instead of having to wait 3 months.
To get access to McMaster University Hospital, Grace's family doctor got a referral from her neurologist. Then it was just a short drive from Guelph to Hamilton for Grace to get her scan. Now that the system is up and running, WTIS is currently working on including all medical procedures by 2009, making it one of the largest medical waitlist systems in North America.
Now it's 250,000 patients a year. It's going to be double or triple or quadruple that.
It's a process that's ongoing. It's got a long way to go, but in the end, I believe it'll make for a better healthcare system because we'll be able to plan based on the real needs of patients, not the needs that are perceived or topical or who's on the front page of the newspaper, but what the system's needs are.
And I just want to get the word out that people have options. I would have been very worried had I not had this CAT scan because, 3 months is a long time. So this was just great. I could not believe it that I had an appointment so quickly.